Hi, everyone. Welcome to our presentation tonight. My name's Linda Gillespie. I'm the practice administrator for the practice. This is Sara Ganeian, and she is our health coach. And tonight's presentation is going to be on Sibo, the small intestine bacterial overgrowth. And our practice, our doctors are starting to test for this more. The more that we learn about it, the more our doctors know what to test for. So without further ado, we will let Sara start us off with all the information on Sibo.
Thank you, Linda. So we're going to talk about IBS, which is irritable bowel syndrome, Sibo, small intestinal bacterial overgrowth, IMO, intestinal methanogen overgrowth, and ESO, intestinal sulfite overgrowth. With IBS, it's probably the term that most of you are familiar with. It affects about 60 million Americans and about 1 billion globally. It hasn't received as much attention, and it received zero funding from the National Health Institute. And the reason for that is because there was no known cause till just the past couple of years. So in the 1990s, physicians were looking at IBS, and they would probably prescribe antidepressant, anti-anxiety, anti-diarrhea, or anti-constipation. And it's really funny because I was talking to a friend of mine who practices GI in California, and she was telling me that a lot of the doctors still think the same. And I think that's really unfortunate because that's really dismissive to the people that struggle with it. It's a real struggle. It affects your daily life. It affects where you can go. Most of my clients, they say that they know where every bathroom is at, like when they go to Whole Foods or Kroger's or shopping. So it really impacts your life a lot. The reason that it hasn't gotten a lot of attention, it's because it's not like Crohn's disease where there is a cause for it and there are drugs, and the pharmaceutical companies make a lot of money based on those drugs. Physicians just tend to treat symptoms, if it's constipation or diarrhea. And most of the time they're like, oh, you just need a therapist more than a GI, which is really not true. There is a gut-brain connection, but it's a real disease. But things are changing. So that's the good news. Things are changing. The Rome criteria for IBS, which is irritable bowel syndrome, and we get to how Sibo and IBS are related, is having abdominal pain at least once a week for 3 months, changes in your stool frequency. So if you're going to the bathroom if you used to go once a day, now you go 10 times a day, or you don't go for days. Changes in stool consistency. So if suddenly you start having a lot of diarrhea or you're constipated. So those are all criteria for IBS. Now, when I talk to my clients, their main complaint is bloating. And bloating is not one of the criteria, which is really surprising to me because that seems to be what most patients complain about. So has Sibo and IBS related? 60% of the IBS patients have Sibo. And Sibo stands for small intestinal bacterial overgrowth. What causes Sibo is slow motility. So whatever that slows down your motility. So the number one cause for Sibo is actually food poisoning. That's the number one cause for Sibo. The food poisoning could have happened 6 months ago, a year ago, or 3 years ago. So that is the main cause of Sibo, and we'll get to how that could affect the motility of your gut. But then there are other causes. So if you've had tubal ligation and you develop adhesion, that can cause slow motility. If you
what is that?
Tubal ligation.
No, it causes what?
Slow motility. So adhesions.
Yes.
Yeah. So when you have adhesion, like any
scarring. Okay,
yeah,
adhesions.
Yeah.
I wasn't paying attention clearly.
So,
sorry about that.
So, or if you have any kind of abdominal surgery that causes scarring, the scarring can cause low motility. If you're in pain and you're on narcotics, the narcotics can cause low motility. If you're on Ozempic, which is a very popular drug nowadays, that can cause slow motility, and that can lead into Sibo. But how does let's go back to food poisoning and talk about how food poisoning affects the motility of your gut. Imagine you go to a holiday party, a Christmas party, or a wedding, and there are about 100 people that eat contaminated food, right? Depending on your genetics, how your gut is working, your microbiome, 9 out of those 100 people will have food poisoning that will lead into IBS. And how that happens is when you eat food that's affected by E. coli, like all the E. coli news lately with the broccoli and carrots and all that, or Shigella or Salmonella. That bacteria releases a toxin in your body, and your body, to fight the toxin, and the toxin is called, and the name of the toxin is important because that's how they test it. So the toxin is CD/TB, and your body starts developing antibodies to that toxin. The antibody that your body releases prevents the migrating motor complexes, which I'll explain to you what that is, from working, and that slows down your motility. So the migrating motor complexes, just imagine at nighttime when the city sleeps, like at Times Square in New York, how those sweeper trucks come around and they sweep the street and clean everything and get rid of all the debris and all that. So the trash wouldn't be, they get rid of the trash. So the next day, the streets will be clean. Your body does exactly the same thing. So you have these migrating motor complexes that are throughout your intestine. And between your meals or when you're sleeping, they just go and sweep your intestine, get rid of the debris, clean it up, get rid of the bacteria, so you won't have an overgrowth of bacteria. When you have food poisoning, the antibody that your body releases in response to the toxin will affect those migrating motor complexes, and they will stop working. And that's why you get lower motility, and that's why you get overgrowth of bacteria. Dr. Pimentel, he's the scientist that has been studying IBS and Sibo for years and years. He actually tested this hypothesis at his lab in Cedars-Sinai. He injected mice with this toxin, not in his gut, but under the mice skin. Mm-hmm. And they all developed bacterial overgrowth. So food poisoning definitely leads to IBS and Sibo.
So when you've got the food poisoning, a lot of times when you first have it, you're vomiting and you have diarrhea. But if it slows your motility, so afterwards, when everything's released, that's when you'll start noticing constipation or things not moving as well as they used to.
Yeah, and there will be a change of your gut microbiome. So it's not like you get food poisoning this week and you have Sibo the next week. It could happen that way, but it could also take a couple of years. It depends how you were to start with, how your gut microbiome, what shape you were to start with.
So maybe the healthier you are, the longer it's going to take to show up.
Exactly. Or you could possibly prevent it from showing up, you know? So, so that's how Sibo and IBS develops. Now, what are the diagnostic and testing? So the testing for IBS, it's pretty new. They just developed the test in the late 2019s, early 2020s, and with COVID, it didn't really get traction till recently. It's a blood test. It's called IBS Smart blood test. You can either order it yourself or you can go through your GI doctor. I normally recommend going through your GI doctor because sometimes insurance pays for it if you go through your doctor, and then you can pay the rest. I think the test is around 240 something, and sometimes the insurance pays for some of it. It's a pretty accurate test. It's blood test that you just put on your forearm, and then you just send it back and you get the result within a week or so. It does have, so it can, the test itself, what it tests for, it's the antibodies to the toxin and the antivinculants. So if your IBS is because of food poisoning, which a lot of the times it is, more than 50-60% of the times it's food poisoning, they can test for that. So if you have IBS that involves diarrhea or IBS that involves a mix of diarrhea and constipation, you can use this test. However, if your IBS is constipation based, this test won't work for you. So that's some of the limitation on the test, because then your IBS could be either food sensitivity or stress related. But if you have IBS-D, IBS-M, this test will be good for you. Now, for Sibo, EMO, and ESO, Sibo is small intestinal bacterial overgrowth, intestinal methanogen overgrowth, and intestinal sulfide overgrowth. There is another test that's called Trio Smart. That is the only test on the market that can test for all three gases. It's a newer test, so a lot of doctors, when you do a Sibo test with them for bloating, they only check for the hydrogen or methane gases. And then you can miss out the hydrogen sulfide, and they say, oh, you don't have Sibo, you're fine, that's not your issue. Where in fact, it could be your issue. So if you're doing a Sibo test, that's the one that I recommend, a Trio Smart. There are two substrates. So there are two things that you need to drink before taking the test. The test itself, you can do it at home. It takes about 2.5 hours to 3 hours. You have to, again, if you go through your GI doctor, your insurance may pay for a part of it. But you can also order it yourself. But keep in mind when you go on their website, if you order the test yourself, the substrate that the fluid that you drink before the test is glucose. So the glucose substrate only tests for the first 3 feet of your intestine. and it misses the rest of your intestine. Whereas the doctor will order a lactulose substrate, which will test the whole intestine. So if you're doing the test, I definitely recommend going through your practitioner, your GI doctor. And if it's available to you, probably testing both glucose and lactulose would be the best. There is a very particular diet the day before. I usually tell my clients just chicken and rice. But if you're vegetarian, there are some non-fermented tofu that you can have. But chicken and rice, and only chicken and rice, is the diet that you should have the day before. And then the day of, there are, I think, about 9 test tubes that you blow in the first test tube before drinking the substrate, and then every 15 minutes you blow into the other tubes after drinking the substrate. That's a pretty good test. That's the accuracy, I think, I'm not honestly sure if it's 80%, 90%, but I've been very satisfied with it with my clients ordering that test. Now, okay, so you do the test and the test comes back negative, okay? So before we go through the treatment options, let's see, you do the test comes back negative. Why is it negative? You still have the symptoms. Why is the test negative? This actually happened to one of my clients this week. She had forgotten to drink the lactulose substrate. So if you don't drink it, the test will come back negative. Yeah. But the other reasons, I wrote all these down so I wouldn't forget. The other reasons is if you've had colonoscopy like 2 weeks prior, or if you had a really huge bouts of diarrhea, like 15, 20 times a day, where you're almost dehydrated. If you use medications such as Ozempic, it will come back negative because it empties down very slowly your gut, so you won't get you won't get the correct results. Now, what if you get the test? You've done everything right. You're not on Ozempic. You didn't have severe diarrhea. You did drink your lactulose, and the test still negative. But you still have bloating. You still suffer from bloating and other symptoms. A couple of things that you need to test for is your thyroid. Do you have Hashimoto's? Is your thyroid working correctly? Do you have diabetes? Do you have yeast overgrowth? H. pylori could have the same. Food intolerances, scleroderma, a couple of other immune disorders, mast cell activation. Or are you chewing your food right? Are you giving are you focusing enough on chewing your food? Is your stomach acid low? Do you have low pancreatic enzymes? So all those things can cause bloating. So when a client comes to me, I would really, if it's available to them, I like to have the Sibo test, their blood work, and also a functional stool test that I order for them to check their gut microbiome, to check their diversity, check their stomach acid, pancreatic enzymes. Those are things that you need to check and rule out.
So if you do those 3 things, that would pretty much take care of, like if it came back negative, it might show up something else.
Yeah,
those other 2 things.
Yes, because if you have like thyroid issues, like Hashimoto's, that can cause issues with motility, and that can cause issues with, or diabetes. Those are all conditions that can affect bloating. And then, so let's go back to, you have Sibo. How do you treat it? You found out you have Sibo. The test came back positive. How do you treat it? For Sibo, EMO, and ESO, which is all bacterial overgrowth in your small intestine, you can do 2 weeks of antibiotics. For Sibo, it's just 2 weeks of rifaximin. If the test is positive for EMO, it's 2 weeks of rifaximin and neomycin. And even if it's ESO, it's rifaximin, and I do bismuth as well with that. The rifaximin, Xifaxan, is quite expensive. So some insurances don't cover it. It's not available to everybody. And some people just don't want to be on antibiotic. There is another route that you can take. It's antimicrobial. For each Sibo, EMO, or ESO, there is a different combination of antimicrobial that you take. The course of the antimicrobial is 6 weeks, though. The antibiotics is 2 weeks. The antimicrobial is 6 weeks. But in clinical studies, they have shown the same effect. There is no difference between doing the antibiotics and the antimicrobial. The antibiotic that you do, the Xifaxan or rifaximin, it does not affect your gut microbiome, which is, so it works differently. It's different from all the other antibiotics. And if you just have Sibo, you can get away with just rifaximin, so it won't affect your gut microbiome. However, if you have EMO, there are 2 different antibiotics that you have to take. One is rifaximin, and the other one is neomycin. Now, neomycin can be really, really hard on the gut and on your microbiome. But I mean, like, if you have to take it, you have to take it, but that could be really, it does affect the gut microbiome. With the I usually recommend testing again the day after you finish treatment to see how effective the treatment was. Sibo is a chronic condition, so about 20% of the cases, they're treated, you never see them, you never hear from them, and it works. But in 80% of the cases, it comes back. So this is really important, that after treatment, you start building up your gut microbiome. That's why I always tell my client, you need to start building your gut microbiome. You have to work with somebody to make sure to help you build your gut microbiome, because you want to increase the amount of time between each relapse, So I have, one of my clients hasn't had a relapse for about 15 months, which I'm really happy about, but she does everything by the book.
Now, while you're doing the antibiotics, are you on a special diet?
Yes.
Okay.
Yes. So all the diets for Sibo, for ESO, for EMO, you need to look at those diets as short-term diet, because they all kind of restrict your carbohydrate and fiber, and your gut microbiome lives on fiber. So if you're doing this specific carbohydrate diet, the low FODMAP diet, with my client, I do the biphasic diet because it's easier. I can tell them exactly how much of what to eat. I can monitor them. We can troubleshoot. But low FODMAP diet works, specific carbohydrate. And if it's ESO, if you're having intestinal sulfite overgrowth, a low sulfur diet. So it doesn't have to be low carb, but it has to be low sulfur.
So like vegetables like broccoli. Or
I've noticed, although meat, like I've noticed with my clients that have ESO, eggs is the biggest thing. Like they cannot have eggs.
Okay.
And like meat is higher in sulfur but it doesn't affect them. I'm not sure how it happens. It doesn't affect them as much as eggs and kale. That has been the two things that I've seen the biggest issue with sulfur.
Okay.
Yeah, but a low sulfur diet, but any of these diets, they're temporary because they take out a lot of the fiber out of your diet. So, and it's some of my clients that come to me, they're like their physicians had prescribed probiotics for them. I usually stay away from probiotics in the beginning of Sibo treatment because you already have a dysbiosis there. You don't want to make that worse. However, with IBS, some probiotics would help.
Yeah.
With IBS, a high fiber diet may help. With Sibo, a low fiber diet would help. So there is, it's really important to know what you're dealing with to know how to treat it. You know, the rifaximin or the Xifaxan works for IBS diarrhea as well. So that's another treatment for it. But you go through the diet, you do the 2 weeks or the 2 weeks of the antibiotics or the 6 weeks of the antimicrobial. You stay on the diet. For me, for my clients, I usually put them on the biphasic diet for about 2.5 months to 3 months. And then I start bringing things in to see how they respond to it. With people with Sibo, so I'm not sure how much you all know about the gut microbiome, but a healthy person with a good microbiome has probably between 150 to 200 different species in your gut biome, which is a lot less than our ancestors. They used to have probably about 1,000 different species. But with the introduction of antibiotics, glyphosate, pesticide, herbicides, we've killed a lot of the good keystone species. Now, a person with Sibo has probably less than 100 different species. So you need to, it's very important that as soon as you finish the treatment, you start rebuilding your gut and resetting your gut. Like a lot of my clients, as they're going through Sibo treatment, they can eat foods high in histamine. They can eat foods high in oxalate, and they think that they're allergic to those foods, but it's just because they lack the gut microbiome. Your gut microbiome, they cross-feed each other. So the metabolites that one make, the other uses. And their end metabolites, which is short-chain fatty acid, we use. That's the food for our colon. So if you start killing the species, some of your gut microbiome don't get fed, and at the end, you don't get fed. So it's very important to reset your gut microbiome as soon as you finish treatment.
Now, with the Sibo, because we're reading so much now about fermented food is good for you, so you should eat at least 5 servings a day, you know, and you want it to be like the good fermentation. But should we be eating that if it's Sibo?
No.
So that needs to come later.
Later. Okay. Yeah. While you're going through treatment, I would stay away from fermented food. Anything that's fermented.
Okay.
Yeah.
And if you have just constipation, is it possible that you have Sibo? Like everything else feels fine, you just figured that this is how your body works, and that's...
So you don't have any bloating, you don't have any pain, you don't have anything else, you just have constipation?
Yeah.
It could be, but not likely.
Okay.
But it could lead to Sibo.
So
because
eventually.
if things, yes. And the other problem is that if you're constipated, your body will loses the ability to detoxify.
Because the toxins stay in your colon longer, the slower you can evacuate it.
Exactly.
Okay.
And you need to go to the bathroom every day. That's just a must. That's how your body detoxifies. So if you're not going to the bathroom, your liver goes through 2 phases of detoxification. And then you excrete everything, you release everything through your bowel movement. If you don't have a bowel movement, what your body what your liver has done is actually has made the what that needs to be excreted more toxic. So then the more toxic metabolites get reabsorbed to your body.
Okay.
So that's why it's incredibly important to go to the bathroom every day. Now you go through all these treatments, you do the antibiotic, you do the food journal, you're still having your issues, okay? Then you need to look for other causes, because Sibo always has a root cause. If it wasn't food poisoning, if it wasn't your Hashimoto's, look for mold. Do you have mold in your body? If you have mold, you need to treat the mold to get rid of the Sibo.
Now, would the mold in your body come from strictly the environment, or can it be in the foods that you eat?
Either.
Okay.
Yeah.
So
it can be either.
I know you've told me before that peanuts can be moldy.
Yes. Yeah.
And
coffee can
beans.
be moldy. Yeah. So.
Okay.
Yeah. But the cases that I've seen, it's been mostly from the environment.
Okay.
Yeah, but you have to get rid of the mold to be able to get rid of the Sibo completely. If you have a lot of histamine issues, the Sibo will come back. If you have, if you're a female and you have endometriosis, you know, you need to, and I see that a lot with my female patients. You need to treat the endometriosis and then, you know, get rid of the Sibo. So there are a lot of, the good news is that the field is moving rather quickly, and there are new tests and new treatments all the time. There is going to be, there's actually, I think, a drug that's being tested for Sibo. So it's going through, you know, trial phase. So that would be, these are good news.
Yeah.
But making sure that you reset your gut microbiome is probably the most important thing you can do for your health after treatment of your Sibo.
If you say, like, somebody meets the criteria for, you probably have Sibo, or you feel like you might have Sibo, but the testing is so expensive, can you still do some of the process and just see if it does help, or is it better to do that testing before you just start trying things?
So with Sibo, if it's hydrogen-based, your symptoms is usually bloating and diarrhea. With EMO, if it's methane-based, your symptoms are constipation and bloating. With ESO, it can be either, but it's mostly diarrhea, and it's extreme diarrhea. So if you've seen a lot of patients with it, you can kind of, you know, but
you start to get a feel for it.
Yes, but I usually like to do tests. The reason that I got interested in this was Austin 20 years ago. My son had Sibo, and there was no testing. There were, you know, no form of treatment. So I've been basically studying this for 20 years, and the changes that has happened in the past 3-4 years, the information that's coming out, it's, you know, rapid, and hopefully we'll have, hopefully more companies will start, you know, offering the test, so the price would come down. Hopefully Xifaxan, I'm not sure if they can take the patent away, so it won't be as expensive, because with insurance, I have clients that pay $900 for a round of Xifaxan. And without insurance, it can be up to $2,000.
That's incredible.
Yeah. There are insurances. I have clients that have family overseas that send them their Faxamin, anti-Faxamin.
Because it's cheaper over there.
It's much cheaper in Europe. It's a different dosage, so you have to double the dose. But yeah, so it's expensive. But then you get lucky and your insurance pays for, most of it.
Yeah.
Which is good news, yeah.
Well, I know just going down through all of this, like I'm old enough that I remember reading magazines and it's like, oh, you want to lose weight, do this. You want to feel better, do this. It seemed like it was so black and white, but it really isn't.
No.
And the more they learn, it's just so individual. So just figuring out what foods you can eat.
Yeah.
And what your lifestyle needs to be. And are you under more stress than you think you are? It's a challenge. We need to make it fun.
Yeah. And it's all needed, like the doctors are just learning about all these as well. Like the practice just started ordering the Sibo test about 3-4 months ago, right? Yeah. So the Trio Smart Sibo test. So it's just, I'm hoping that the MAs will start telling patients about the IBS Smart test. So the people that want to be tested are able to test it. You just want to go through the elimination process, because it's not a fun disorder. Sibo, it's or IBS.
Yeah.
It affects your gut, it affects your life, it affects your socialization.
Yeah, if you're always afraid something's going to happen while you're out.
Exactly. Yeah. And another little hint that you would know, Sibo, if you eat food and you get bloated like within 10-15 minutes, then it's Sibo, and it's just not normal
because
bloating.
It'd be the gases in your stomach
exactly.
that are suddenly
because
expanding.
The number of the bacteria, there are only 2 bacteria, the E. coli and Klebsiella, that causes Sibo. They've actually mapped the bacteria that causes it, and there are so many more of them because your small intestine, it's supposed to be sterile, or things are supposed to be in balance. But when they go, there is such a huge overgrowth, within 10 minutes, 15 minutes of eating, you get bloated.
Okay. Now, sometimes, like with the bloating, let's just say you don't feel as bloated. Is it possible, though, that you're burping or that it's leaving your body in other ways?
Yeah, actually, I have a client that burps a lot. Yes. So she has bloating as well, but burping is what bothers her the most. Yeah. So burping is another. Yeah.
Okay. So, and if you guys do have other questions that you want to send to us, our email is info@texascolon.com. And that's on our website where you can email us if you think of other questions, and they'll get forwarded to us and I'll pass them on to you. Or if it's something that our practice handles, then I would tell you, we can make an appointment and have you look at that. So it's nice that there are specialists, but sometimes we're so specialized that figuring out what doctor you're supposed to see for what becomes a problem. So, or you go to one doctor for your diabetes and another one for your colonoscopy, and the issues are actually interconnected. So it's a challenge.
Yeah. And hopefully maybe we should have a Sibo support group and coaching in the office.
That would be fun.
Yeah. I do have a group coaching for Sibo, but it's all Sibo and not emo. It'll be difficult if they're different.
Yeah.
Yeah.
So,
well, thank you all for attending. Yeah.